I'm Kobe Smith and I'm from Guyana. I serve as board member at the IPPFWHR. What excites me the most about sexual and reproductive health? I'm enthralled by the energy and passion of young people who are demanding justice and education, and who are also demanding and speaking and standing in their truth. The only way we could actually guarantee sexual and reproductive health, especially for young people and gender diverse people, is if they all stand up and demand what they want. Demand more services, more information, more education, and more justice. And that is exactly what we all need. Universal health coverage is rooted in fundamental human rights. The idea that all people, regardless of who they are, how they identify, or the communities they're from, that they have the right and the opportunity to have access to quality health services to ensure that they address their well-being and their health, but also to achieve their rights as citizens of countries of the world. I am so thrilled and honored to have been part of a project by PAHO WHO in Guyana, where I would have coordinated and delivered more than 500 contraceptive services and also HIV testing to vulnerable women and girls in Guyana during the course of the COVID-19 pandemic. Of course, we in Guyana are not fully where we need to be when it comes to achieving universal health coverage. But what I have done with this project with PAHO is really trying to cushion the effects of the COVID-19 pandemic on the vulnerable communities of people, where I would have ensured that young women and girls, particularly indigenous women, but vulnerable women, women who are unable to afford out-of-pocket costs for services, have access to those services to ensure that they prevent unwanted pregnancy, but also prevent and respond to health challenges related to HIV and the treatment of that. In 2013, the United Nations Population Fund recorded that Guyana had the second highest rate of adolescent pregnancy in the Latin American Caribbean region, with 97 out of every 1,000 girls between the ages of 15 to 19 giving birth. That is actually a crisis. And with my contribution in terms of ensuring that we have universal health coverage for adolescent mothers, adolescent girls, I would have championed the cause of ensuring that there's a national reintegration policy for adolescent mothers to ensure that they are reintegrated into schools to complete their secondary education. I would have gone to the Organization of American States to champion advocacy and to lobby the government of Guyana to not just finalize the policy, but to implement the policy. And today, in 2021, the Guyana Responsible Parenthood Association, but also the Youth Advocacy Movement, an organization that I would have served as president, have been listed as implementing partners of that policy. Whenever we think about family planning and health coverage, innovate, collaborate, and accelerate, we think about all the partners that could participate in ensuring that we do more for people in our countries to ensure that they really and truly have the highest attainable standard of health to guarantee their rights and their well-being.